We all want life to return to normal as soon as it's safe to do so. Our hearts break to see closed storefronts and people struggling to make ends meet. Each day people call me and write me and tell me their story and urge me to keep people safe while also doing everything we can to protect the businesses and the lives of working men and women who are the heart and soul of our state. At the same time, they and we know that reopening too soon and too aggressively is likely to cause a secondary surge in COVID-19 cases, jeopardizing the lives of many more Maine people, overwhelming our healthcare system, and further destabilizing our economy. None of us want that. That's the truth, and I'm not going to sugarcoat it. Here in Maine, we are pursuing cautious reopening, tailored to our state's unique demographics and economic sectors. Our approach will not be driven by artificial deadlines or generic guidelines, or it will be driven by public health considerations, fact and science, and it will be done in collaboration with you in the private sector. The basic principles that Maine will follow as we reopen our economy over time are: 1, protecting the public health. The state of Maine will continue to rely on epidemiological data such as case trends, hospitalization rates, recoveries, and deaths to inform the decisions we make along with the private sector in lifting restrictions. 2, maintaining healthcare readiness. Maine must retain its capacity to respond to any surge in this virus. To that end, the state will continue to work closely with all hospitals and healthcare providers to assess system capacity, including available hospital beds, ICU beds, ventilators, and we will continue to procure and distribute personal protective equipment as needed to hospitals, nursing facilities, emergency service personnel, and other frontline responders. 3, building reliable and accessible testing. Testing capacity for all people who are symptomatic and sentinel disease surveillance are key elements of reopening various sectors of our economy. While the widespread availability of rapid testing remains a challenge, the state is actively seeking to expand testing to make it more accessible to Maine people. 4, prioritizing public-private cooperation and collaboration. Collaboration and leadership among businesses, employees, government entities, and the public. You. Those are vital to develop, oversee, and adapt guidelines and safe practices. Government alone cannot fix things. Government doesn't always have the answers. We need the best thinking of all Maine people from every industry and every corner of the state to reimagine and reinvent how we do things in this state in a way that protects both our lives and our livelihoods.